I'm Dr. Jim, and I have a question for you. What is life like in rural nursing homes? Wrote a little article, and now we're shooting a little video for you to explain. Life in rural nursing homes, challenges and opportunities. That's my topic. So, although many skilled nursing facilities face very common challenges, like maintaining their census, recruiting staff, retaining them, delivering high quality care, rural facilities are against some fairly steep odds in doing so. And I'll tell you why. They also face other unique problems that many skilled facilities don't. And despite this, they are a group of facilities that have some very interesting opportunities. They've got their challenges, but they also have some opportunities that maybe large city nursing homes, urban or suburban nursing homes may not have. Let me give you a snapshot of rural nursing home residents, the folks that are living in these nursing homes out in the country. Okay? Number one, they're being admitted older and sicker. They're staying home. Maybe they're taking care of themselves. You might have an older couple taking care of one of each other as long as they possibly can. And then finally, they're admitted into a facility or they move into a care community. They're moving in older and they have more comorbidities because they may not have had the resources within their small rural town. Okay? Number two, they have fewer resources. Residents from rural areas have fewer resources like lower incomes, higher poverty rates, little to no health insurance. Characteristics like these lead to what? Poorer outcomes, sicker people. So, there are some organizational and operational challenges to rural nursing homes. Number one, there's a smaller talent pool of job candidates to choose from. Number two, they're gonna struggle with census because they're so far out. I've read that your typical rural nursing home is at least twice as far away from a hospital than those found in urban or suburban areas. What does that mean? That could mean a half hour or an hour and a half. That's what it means. They're out there. There are fewer and smaller rural hospitals to choose from. Companies are coming in and buying up hospital chains around the country, and they're looking at the profitability of these little hospitals out in rural areas, and they're shutting them down or they're downsizing them, and that's a major issue. It's almost like rural seniors are a forgotten group of people in so many ways. Care coordination issues. Okay, so we're out in the country, we're out in rural areas, we don't have a lot of resources, we don't have a lot of services to coordinate to begin with. So there's the challenge, we have to coordinate with services that are an hour away in a suburban area or a larger city. That causes a lot of care coordination headaches for social workers and case managers, nurses, doctors, you name it, okay? Now, challenges in providing care. So the nursing homes themselves have problems and challenges, but what about the care staff? Well, number one, they may not get a lot of current training in particular care areas. They may not receive a lot of specialized training. in areas like memory loss, mental and behavioral health issues, wound care, trach care, IV antibiotics and tubing requirements, cardiac problems, obesity, COPD, cancer, diabetes, and Parkinson's disease. Well, I would imagine that a lot of residents living in rural facilities have a handful of those diagnoses I just listed. So we don't have a lot of employees. We don't have a lot of candidates to choose from. And if we have turnover, we're going to have quality problems and we're going to have problems with consistency in care. We also have a problem if we're out there in rural areas getting the right equipment, enough equipment, and new, better equipment. We may not also have the space. Why does that matter? Years ago, I helped a skilled nursing facility to create a subspecialty in one particular area. And that particular area was in bariatric care. And the interdisciplinary team and I sat down after I got good training and education from a bariatric physician who is actually a leader in bariatric care in one of the states. And we sat down and we started looking at equipment. We thought, we'll just get bigger wheelchairs. We'll just get bigger beds, bigger sheets, bigger slippers, bigger needles, larger blood pressure cuffs. Are the doorways large enough? Is the bathroom big enough? We literally had to get the maintenance team to gut out rooms and bathrooms and start from scratch and make those spaces larger and more appropriate to care for patients with obesity issues, and they required bariatric care. So equipment and space, massive topics to talk about when you're out in rural areas. Now, here's some opportunities. Okay, so that's those are the issues, those are the problems. Well, there is no shortage of problems, issues, or challenges facing today's rural nursing homes. They do have some unique and promising opportunities to make care and life better for their residents. Thankfully, there are trends in combining services, packaging up services to meet the unique needs of rural residents out in the countryside. So packaging up these services might provide more options, better coordination, and greater continuity across care settings. Okay? And we're finding that there are some unlikely care partners out there. What do I mean? Leading the way to improve rural nursing home care are churches and other faith-based groups, community colleges, and rural community hospitals. Services provided by these collaborators include management and financial expertise and resources, training for direct care in specialty areas, sharing evidence-based practices, particularly in areas like fall prevention and medication compliance. Another opportunity, integrated care approaches. Experts around the country are working to create a better system that will provide much needed resources and services to rural nursing homes. A lot of people know that this is a problem now, and they're jumping in to help. They're building on both formal and informal partnerships to deliver what these facilities and residents need the most. New models of care are being developed and include resource and referral sources, greatly needed, care management programs, incredibly necessary, fully integrated care delivery systems, home and facility-based services. All important. Now, here's some keys to success. In order to successfully develop and sustain care and services in rural elderly care settings, a few key components are required to accelerate this process. Here are the nuts and bolts. Let's get them going faster. Many experts agree that a strong community infrastructure, community-based providers, care coordination systems, informed consumers and families, and partnerships can all be helpful in lifting today's rural nursing home to a better place. So there you have it. It's a need. There are problems. There are gaps. There are long geographic distances. Rural nursing homes are presenting both challenges and some unique opportunities that we need to pay attention to. I'm Dr. Jim. Thank you for paying attention to my topic today. I'll see you soon. Well, I certainly hope you enjoyed the video, and thank you very much for your time. If you'd like more information about a great online learning management system with the most wonderful support, best in class support, and partnering, please look for the link to the website in the description. You'll love what you see.